for being with us. I know you wrote this bill with Lindsey Graham. We had him on yesterday. Many of our viewers are confused about this. They have questions. First of all, the main issue here is the pre-existing conditions. So many people have been asking questions about pre-existing conditions. Can you guarantee that these governors, if they get this money, that they will make sure those folks with other diseases already, that they'll be covered?
The legislation says that nothing the governor asks for will be approved unless there is affordable and adequate coverage for those with pre-existing conditions. President Trump tweeted last night he will not sign legislation unless it protects those with pre-existing conditions. My own story is that I worked for 25 years in a public hospital for the uninsured, sometimes treating those who lost their insurance because an insurance company cut them off because they had a pre-existing condition. My life's work has been taking care of those folks. We continue to take care of them in this legislation.
Most of the opposition is really not coming from Democrats yet, even though they're not happy with it. It's coming from Jimmy Kimmel out in Los Angeles. He called you out again last night. Watch.
They're not taking care of you. They're taking care of the people who give them money, like insurance companies. Most of the Congress people who vote on this bill probably won't even read it. And they want us to do the same thing. They want us to treat it like an iTunes service agreement. And this guy, Bill Cassidy, just lied right to my face. When Senator Cassidy was on my show in May, he told me he believed that every American family, regardless of income, should be able to get quality health care. And I believed he was sincere. Sadly, the bill he unveiled last week with Senator Lindsey Graham indicates that he was not sincere. It is, by many accounts, the worst health care bill yet.
Your thoughts?
Yeah, so Jimmy doesn't understand, and not because he's a talk show host, because we've never spoken. He's only heard from those on the left who are doing their best to preserve Obamacare. He's not heard from me. We've not spoken, and I would love to talk to him about this.
He said you were on his show, though.
Oh, we were on a show a year ago, and everything I said in there is true. There's a tension. How do you pay for it without breaking the bank, and how do you take care of those providing insurance? Right. Our bill does that. It gives billions to states like Maine, Virginia, and Missouri, so the low income, that their states don't have right now, that those lower income families can have access to insurance and care for their pre-existing. He just doesn't understand that. And I say that not to provoke, but just to actually ask for him to at least consider those families in Maine, Virginia, and Missouri.
Absolutely. Senator, we do know in your plan it gets rid of the employer mandate, and a lot of businesses love that idea. Ultimately, it comes down to this. For the families involved, is it cheaper and is it better than what we've got right now?
Absolutely. There's a fellow back home, and by the way, let me start over and say that if you're kind of getting a benefit, I can see why you feel threatened. No one likes change. But there's a group called the Strivers, the group that is trying to, making more money and really working hard. They work so much they don't get a subsidy. There's a fellow back home with a special needs child. He's paying over $40,000 a year, over $40,000 a year for his premiums, has to have insurance, has a special needs child, and it's estimated his premium goes up 20% this next year. That does not take care of a striver, does not take care of somebody whose child has a pre-existing condition. Our bill gives the state the opportunity to do something that does.
And real quick, Graham Cassidy, they say, takes a crowbar to Medicaid. That, according to some Georgetown University Center for Children and Families.
Yeah, totally wrong. In the traditional Medicaid program, all states are going to a capitation. It means they pay the insurance company a certain amount per person. This just says, okay, the federal government will pay a certain amount to the state, and the state will pay a certain amount to the insurance company. Let's just kind of line things up. That's just doing what the states already do, but it protects the federal taxpayer from people making kind of an open-ended run on the federal tax dollar.
Well, the big vote, it looks like it's going to be in the Senate next week. Senator Cassidy, thank you very much for joining us live today.
Thank you, Senator.
Thank you.
All right.